Okay, so today I have an order to access a patient's port line, central access, and to get labs, some blood work from that. So I'm verifying the orders and all of that looks correct. So before I would enter the room, I would gather all of my supplies, including my port kit, my Huber needle, my male adapter, some normal saline, and a couple of masks, one for me and the patient. And then I would go to the patient's room, and as I'm going in, I'm washing my hands, and I knock, knock, knock.
Hello,
Hi, my name is Anastasia. I'm going to be your nurse today. Can I get your name and date of birth?
Furry McBayer, and 22201.
All right. And McBair, do you have any allergies?
I'm allergic to morphine.
Okay. Well, I don't have any morphine for you, but your physician has ordered for me to access your port line. Do you know what kind of port you have?
I don't, but here's the card.
Okay, thank you very much. That it helps. So I am washing my hands again, and the first thing I'm going to do is I'm going to set the head of your bed up, okay? Get you situated in there. Okay, and then I'm going to feel where your port is. So, all right, that feels good. And I am going to put a mask on you. And if you could turn your head away, that'll help keep it clean. And I'm gonna put a mask on myself too, just to keep it as clean as we possibly can. Okay. And I am going to carefully open the package of the Huber needle, the male adapter, and the normal saline. And I am going to take the needle, being careful not to touch above where the sterile line is. I'm going to attach the male adapter, and to that I am going to attach my normal saline. And then I am going to place that back in the package to try and keep it as sterile as possible. And then I am going to open very carefully my sterile kit. And the first thing I want to do is put on my sterile gloves. Now my hands are sterile. I'm going to keep them above my waist. And so since they're sterile, I can now reach into my package and grab things out of there that I need, such as my little sterile field area and my Tegaderm. I'm going to get out some 2x2s. Just in case. My cleaner, some tape, my Gardiva pack, and I'm going to open that and lay it carefully there so I have access to it later on, and my alcohol prep pads. Also, I would make sure I had the blood tubing that I needed and the normal saline that I needed to get my blood sample. So I have felt where the access port is, so I'm going to take my cleaner and I'm going to clean across and down in a hashtag motion for at least 30 seconds. I'm going to throw that away and make sure that air dries. I'm not going to blow on it, and I'm not going to wave on it or anything like that. At this point, I would take my, carefully out of the package, take my needle that has my saline hooked up to it. Oh, and before that I would unclamp it. I would have unclamped it, primed it, and then clamped it again. So this is all primed already. So then I have this primed needle, and I'm going to pull the skin taut, and I'm going to say, okay, on the count of 3, I'm going to stick this in you, okay? 1, 2, 3. Okay, so that's in. And then I would unclamp it, pull back for a flash of blood, and then once I got that, okay. And then I'm going to push, pause, push, pause, push, pause, and I'm going to flush it. And then I am going to take that off and throw it away. And then with my still sterile hand, I'm taking the Gardiva patch and I am putting that around the bottom of the port here and making sure it's against the skin and surrounding the port. And then my sterile part is done at this point, so I'm just going to take my Tegaderm and I'm going to apply that to the skin, making sure that the clear window is, you can see the port and you can see the Gardiva patch, and that the tubes are sticking out the little slit part at the bottom there. And I would label that with my initials and the date and the time that I put that on there. And at this point I would go ahead and draw up some blood. So I am going to take, the alcohol swab, and I am going to scrub the hub for 15 to 30 seconds, let that air dry, and I'm going to take my normal saline, put that on there, pull back for a flash, and then do the push pause and flush it. And then I would pull back the amount of waste I needed of blood, and that's 5 to 10 cc's per hospital protocol, and I would dispose of that blood, and then I would get a clean syringe and pull up the amount of blood I needed, and I would put that in the tubing, making sure to go back and forth as needed and set that aside for just a minute. And then I would take another normal saline, hook that up, and use the push pause method to flush all the blood out of the tubing, and then I would clamp it. At this point, I would either hook them up to an infusion or I would put a heparin lock on there, whatever the patient needed. I'm going to take my blood specimens and label them with my date, or my name, the patient's name, the date and the time, and get those sent down to the lab. I'm going to document that I did the procedure, that I drew the blood, how well they tolerated the procedure, and all that kind of thing. So I can take this off them, can take it off me. Are you doing okay, Mr. Bear?
Yeah, I'm doing good.
Okay, so I'm going to put the head of the bed back down, make sure they're comfortable. And here's your call light. And keep an eye on that. If it starts hurting or if it gets red or if you feel like you're getting an infection of any kind, let me know, okay?
Okay.
All right. So it's been a couple days now, and I have ordered an order to de-access the port. And so I am going to gather my supplies, including normal saline and my heparin, and I'm going to verify that I need 10 milliliters of normal saline and 5 milliliters of heparin. So I'm going to gather all those supplies up. So, and then I come back to the patient's room and I do hand hygiene. Knock, knock, knock.
Hey,
My name's Anastasia. I'm going to be your nurse again. Can I get your name and date of birth?
Furry McBear, 2/22/01.
Okay, and do you have any allergies?
Morphine.
Okay, so I don't have morphine for you today, but I do have an order from your physician to de-access your port. Okay, do you have any questions about that?
Nope.
Okay, so I'm gonna go ahead and, just like we did before, I'm gonna put my mask on, and then I'm gonna ask you to wear a mask as well. Okay, and turn your head.
Okay.
And I'm gonna put the head of your bed up again so we can get good access to that port site. So at this point, again, I'm gonna do hand hygiene and just put on clean gloves. And I am going to pull up on the Tegaderm all around the port, and I'm gonna look at it, make sure there's no purulent drainage, there's no redness, there's no swelling, there's no inflammation, there's no pain. And it all looks good. So I am going to unclamp it, scrub the hub for 15 to 30 seconds, let it air dry. I'm going to hook up the normal saline and use the push pause method and flush the line with the normal saline. And then I am going to get the heparin and do the same thing. Push pause, and I'm going to flush with the heparin. And at this point, everything is still looking good. So I'm gonna make sure I've got a 2x2 here and my tape on standby. And I'm gonna pull the rest of the Tegaderm off. And then I'm going to say, on the count of 3, I'm gonna pull this out, okay?
Okay.
1, 2, 3, pull that out. And then I'm going to hold pressure. I'm gonna check the tip of this to make sure it's intact. I'm gonna throw that away, and I'm gonna hold pressure until hemostasis has been achieved. And once that is done, I would probably put a clean gauze over the top and tape it down really nice. And I'm gonna take the mask off you, the mask off me. Okay, are you feeling okay?
Yeah, I'm good.
Okay, so I'm taking this off. I'm getting the call light nice and comfortable. I'm gonna document everything that I did, that I flushed with heparin and normal saline, and that they tolerated the procedure well. I'm gonna do hand hygiene, and then I'm done.